Welcome back to a slightly different GBGuns. No firearms in this one, but stuff that's important because of firearms. You know me, you know Tia. Who you don't know is Brian here from Mountain Man Medical. Brian, tell us a little bit about yourself.
I live in Colorado, in Denver, and work for Mountain Man Medical. We do a lot of trauma kits. I'm the subject matter expert. Spent some time in Afghanistan with the Marine Corps, taking care of their bubbas and working on them. Had a great time with that. Enjoyed my experience and taking those experiences and making the trauma kit. And I've got a YouTube channel if you want to check me out. I'm over at Mountain Man Medical, so you can find me there. We talk a lot about basic life-saving things, how to use the stuff that's actually in your trauma kit so that you can take care of somebody. Like, one of the main things is making sure you have that training, because it doesn't do you a whole lot of good to buy a kit and then not know how to use it. You got to know how to use the gear that's in it so that you can. Yeah, and
one of the things that has changed and has been a topic between Tia and I, Tia was a medic in the Army, is what I was told getting ready for Afghanistan in 05, what I was told getting ready for Iraq in 08, what Tia was told for her tour 09, we're all different. Things have changed, techniques have changed, technology's changed, gear has changed, and so that's why you haven't seen Tia or I talk about the medical stuff on the channel yet. We wanted to bring a current professional in, and that's why Brian's here, so we'll get to it.
So out of curiosity, Graham had an old IFAK from his tour in Iraq. So I wanted to see what is in here. I've only opened it briefly, haven't really gone through it all, and have Brian then kind of tell us what is in here that has changed and all that good stuff.
And as they get into this, a reason why we thought this would be a good starting point is a lot of the medical advice you see out there is, oh, so-and-so's a veteran, so-and-so was in the Army, was in the Marine Corps, was in the Navy. Point being, there was something that was taught, but for a very specific situation. And though the trauma we face on range may be very similar to combat trauma, the techniques, the technology, the gear has changed a bit.
And so is the knowledge, and so has my comfort level in giving instruction on those things. I don't want to give any of our viewers bad advice or anything like that. So I really appreciate that you're here and can get us up to speed with what's current today and what our best options are for trauma, not a first aid kit, but a trauma kit on the range.
We're learning that a lot of these old techniques that we were doing are either wrong or we could be doing them better. And that's our whole goal. Do things better, save more lives. I think that's what I get the most out of it.
So let's take a look at the old. That is probably what most viewers have been told to use.
This is, what year was it?
08.
08. So you've got some rolled gauze. This is still, this is a good thing to have in your kit for wound packing, junctional wounds. Obviously you can't use tourniquets on junctions, and a junction is any place where two body parts come together, like in your armpit, your groin, where your legs come up to meet your torso, and then also in your neck. So you can't put a tourniquet there. It won't work. So you need to learn wound packing, and the gauze is a good way to do that. And this is still vacuum sealed, so it's probably good, but all medical gear is perishable. It has an expiration date, so if you're one of these guys that also has one of these kits, you haven't opened it in the past 10 years, it's just been rattling around in your truck for a while, there's a good chance like UV light getting in there, making things, not so good anymore. And you pull out your tourniquet or your pressure dressing and it just crumbles into your hand, that's no good. So make sure that you're double checking all of your kit and making sure it's not expired.
And for the record, I have heard that a tourniquet on the neck will stop bleeding eventually.
Mm-hmm. Yes, absolutely. It will stop all bleeding. Just make sure you don't really appreciate them too much. The thing that this has that I don't recommend that you have unless you absolutely know what you're doing is needle thoracentesis. That is something that you need to be trained up on and know what you're doing so that you don't further injure your casualty. You don't want to give them a second chest wound if you don't have to, right? So punching a hole in someone's chest is not a good idea. You have to know the landmarks, so get that training before you use it. This is the NPA. This is another thing that tends to go bad pretty quickly. The rubber will degrade, and you always want to try to make sure that you've got some sort of lubricant with it. This I think is packed with a lubricant already. It's got a little lubricant packet in there. Yeah. And a lot of times that lubricant packet will also, the other thing that I see here are the chest seals. And chest seals will lose their stickiness over time as the kit itself degrades. It's a decent kit. Obviously, you want to make sure that it's not expired, and yeah, get yourself some new medical kit if you need it.
Even if something's expired, you said these are sealed well. I probably wouldn't want to throw this away, because in a trauma event, this might be all I have.
Yes, yeah, I always hang on to all my old stuff until I get new stuff to replace it, because something is better than nothing. That's one of those old medic maxims, right? It's better to have something than nothing. So yeah, I'd hold on to it until I got something better. Fortunately, stuff like this is not that expensive. Like rolled gauze, you can pick that up. I think we sell that on the Mountain Man Medical site for like $4. And then the pressure dressing, you can get a good Elias bandage or an Israeli style bandage, which are very good pressure dressings. Those are also cheap. So a lot of this stuff is not expensive individually. It kind of adds up as you add more things into the kit. But overall, this is not that much money. A lot of times I hear people say like $30 for a tourniquet. Are you kidding me? But that's $30 to save somebody's life. So yeah, I agree. Maybe they could be a little bit lower in cost or something like that. But at the same time, that's not a whole lot of money.
Yeah, you can't put a price on a life.
Not if it's my kid or my wife.
Right.
No, $30.
I don't think I'd be going for a discount tourniquet.
No. Okay. Well, that's a very good point. So, one of the things that makes me a little bit upset is that there's a lot of counterfeit cat tourniquets out there coming from China. In my opinion, that could be considered an act of war, because they are shipping us faulty medical equipment that does not work. I've got a video on my YouTube channel where I go through why counterfeit cat tourniquets are a bad idea. So make sure that you know where your cat tourniquet is coming from. Amazon is not a great place to get it. Make sure that you're finding a reputable company that are sourcing their products straight from North American Rescue. I haven't seen any counterfeit tourniquets when it comes to like SWAT-T wides or any of the other more popular tourniquets on the market. So just be extra careful whenever you're buying cat tourniquets. I've also known a lot of companies that are producing trauma kits who source these very cheap tourniquets because it saves them a lot of money. And I'm guessing that they're not doing it maliciously. They're just seeing a cat tourniquet and they don't know enough to know that that's a counterfeit cat tourniquet, and it could get somebody killed. So make sure, even if you bought your kit from a reputable company, go in there, look at that cat tourniquet, and make sure it's legit.
How would one be able to determine that? What is something that they would look for? Is it a label? Is it a feature?
Yeah, well, we can kind of look at that a little bit here. This is a legitimate cat tourniquet, and it will have the lot number. It will say cat on the back, which is very important. It'll have an NSN number.
So I haven't unwrapped this one, and it's mostly to make a point. This came out of an inexpensive first aid kit that we have. And what I noticed about it first is if I was in a trauma situation, this is going to slow me down. So the first thing I would do in that kit is open it up so that it's usable, because as I'm doing this now, it's not easy, and if my hands were sticky, slippery, or otherwise, we just cost someone's life a couple of minutes. This already tells me that it's probably legit, in that it comes with the info inside. And then again, just looking for information, there it is.
Yep.
Right there, easy to spot on the front. So we know we've got a good tourniquet there. And you said there were differences here. I'm noticing now more that they're unwrapped, the twister.
Exactly, yep. The windlass, it has cat written on it. So that's another identifier. I mean, you shouldn't need all of these markings, but it helps to kind of make sure that what you're looking at is correct. And it might be a little hard to see on the camera there, but it says cat here, and then in a couple of different places. So you'll know that this is a legit one. The tourniquets coming out of China, don't even bother with that, because they're selling crap loads of them, and it's going to cost people lives. I actually know a paramedic at Denver Health who their ambulance was stocked with counterfeit cat tourniquets, and he got one out to start working on a guy who had been shot in the leg and started cranking it down, fell apart. And fortunately, he had a legitimate cat on his person, whips that out, puts that on the casualty, and saves the casualty's life.
So we hear about these all the time though. When is it appropriate, genuinely appropriate in today's standards, to use one?
Bleeding, massive bleeding. If you are worried that that's a lot of blood and you don't know if you need to put a tourniquet on or not, put the tourniquet on.
Okay.
The old way of doing things, there's a lot of rumors out there, myths, that you will lose that limb if you apply a tourniquet. That is absolutely false, and it's gotten people killed because people are worried that if I apply this cat tourniquet or I apply this tourniquet to this person, they're going to lose their leg, so I'm going to wait, and while they're waiting, they're bleeding out, and that's not what we want. You have 2 hours. That's the general rule of thumb. I've read studies of casualties who have gone 6 hours with a tourniquet in place. They were taken back to surgical care, and now they have complete use of their limbs, no problems whatsoever. But the general rule of thumb is about 2 hours. So if you're in America with current EMS, you're going to be just fine for the most part.
So it's not just a gunshot. It could be a knife wound.
Yes.
You know, just depending on where you're hit and the quantity of blood that you're using, you need to keep that in mind.
Absolutely. So in my mind, I'm always thinking about combat, right? Like fighting someone with a knife or a gun or something like that, right? But in reality, I also do a lot of housework, you know, around my house. I'm fixing something, I slip with my utility knife, open up a trench on my arm. Now what are you gonna do? There's lots of times where that's happened. Not to mention, I have 3 savage little sons running around doing all sorts of crazy things. I wanna know that I've got a good medical kit nearby that my wife or me can run and grab. I try to put that medical kit in a place where my sons can get it as well. So if I need to yell at them, go get the trauma kit, they know exactly where it's at. They also know what's in it. And they also know how to use direct pressure and a tourniquet. So kids can do this stuff too. It's not just for adults. I think they should be teaching this stuff in school personally.
I would agree.
Mm-hmm.
So now you've got me really curious in what is in a current trauma kit compared to what we've seen.
Okay, perfect. Yeah, I've got plenty of ideas about that. This is the trauma kit that we sell on mountainmanmedical.com. So if you like what you see, feel free to head over there and check this out. This one is the Yellowstone, and it's our best seller. Cat tourniquet, this is an upgrade. You can upgrade to this if you need to. Or if you don't have the money for it, you don't have to. There's another tourniquet option in here if that's not something that you want. But I usually try to recommend that people upgrade to a cat tourniquet. It makes it a lot faster and easier. You don't want to be playing around while someone's bleeding to death. So I like to have that. Next, we've got some rolled gauze. This is beneficial for putting more wound packing material into the kit so that it helps to add to redundancy.
Well, and what I like to point out about rolled gauze is it's rolled. You assume you have to unroll it to use it. Absolutely not true. Break it out of that package and put it directly on, apply your pressure, and then if you need to stabilize that there or add more packing, then you do that. Rolled gauze does not have to be unrolled.
Yeah. You can pack it in there. It depends on the size of the wound too. Like if you've got a big wide trench, not all wounds are going to be holes, you know, punch in, punch out. You could have a large trench. You might need to taco fold your material and get it wedged down in there to get all of the bleeding arteries packed up. So yes, it kind of depends on the wound that you have. So making sure that you understand how to pack a wound is essential. It's not going to do you a whole lot of good if you don't know the technique.
So that's one item I probably would not unwrap in my trauma kit.
Yeah, I would probably keep that in the wrapping, definitely, because it's going to be more sterile. We don't have a whole lot of issues with that as civilians because we're going to get to hospitals so quickly, and they're going to start you on antibiotics immediately. But in the military, it's much more of a big deal because of the environment that you're in.
What else have we got?
So next is another favorite item of mine. I love multi-use items because we don't have a whole lot of room to carry all of this stuff, and having redundancy, things that can work on multiple things, is always a good idea. And that is just more well known as an ACE wrap. It's an elastic bandage. It has hook and loop, which is a big deal for me. A lot of the kits that I see they go the cheaper route with those types of elastic bandages with the little metal clips. Do you know what I'm talking about?
Yeah.
Those little metal clips are so annoying because you're running up on a casualty, things are going crazy, you whip that out and you open it up and those little clips go flying.
I don't remember using those because we lost them. We would just tuck it under.
Yeah, and they're in the dirt.
Wrapped.
I'm not going to go hunting around for those. So the hook and loop, in my opinion, is a quality of life thing for a medic. You don't want to be hunting around. You want to be able to get your job done efficiently, and that's a great way to do that. So we've got that. Back behind there, we've got our chest seals, and these are the Hyfin vent chest seals. And these are great because you can't really use these wrong. It's just a sticky piece of rubber. So if you put one on somebody and they didn't really need it, they'll just lose a little chest hair, not a big deal,
okay.
Right? So
how are these any different than what were in the aid kit?
They are different. I believe they're made by a different company. I don't remember the one that's in there. This is the newer one. It's vented, so it's to prevent a tension pneumothorax, which is when air gets into your chest cavity and it starts to build up pressure over time. And that pressure eventually puts pressure on your heart and causes your heart to not be able to beat fully. So basically you're bleeding out from the inside in a way, even though there's no external bleeding. Your blood is not being carried around the body, it's not oxygenating your brain, and you can die that way.
Okay.
So it's just a different way of bleeding to death, in my opinion. And one of the most important things is to have two, because if you have a bullet hole, you might have an entrance in and an entrance out. Not all the times, exit out. Not all the times, bullets do weird things, they bounce around, sometimes they just stay in the body and you never know. But if you have two holes, you need to be able to patch both of those or you're not doing any good. Yeah. So make sure that you have at least two chest seals. So very important. Last thing in here behind that is the QuickClot. And this, most people will probably know what that is. This is kind of a household name. The QuickClot is impregnated with a hemostatic agent, and hemostatic just means makes the blood clot quicker. And that's beneficial because it's going to give you a robust clot at the end of that bleeding artery and help to seal it off a little more efficiently. But a lot of your bleeding control is going to come from wound packing. That's packing the wound with lots of gauze so that gauze gets right down on top of that bleeding artery, and that's putting pressure to clamp it off. And that's where a majority of your bleeding control is coming from.
So how would your average Joe at the range know the difference in when to use what bleeding stop source?
Come to my YouTube channel. I talk all about it. That's the best way to learn, I think.
Okay. Yeah, it is actually. Yeah. I mean, you've got to get out there. You've got to scenarioize these, situations, and repeat them in your head. That's how we're taught in the military. Yes. But for me, it's been, I think 10 years since that I've taught any of this kind of stuff. So even for me, I'm forgetting. When do we use what step of bleeding control? Yes,
so the March algorithm is the thing that we learned in the military, and that's generally my go-to. If I'm trying to remember what step to go next, March, M-A-R-C-H, the March algorithm, is it's a step-by-step procedure. You start with massive bleeding. After you have taken care of all of the bad bleeds with your tourniquets and your pressure dressings, then you go to A, which is airway. You got to make sure that they can breathe in and out. It doesn't do you a whole lot of good to stop the bleeding if they're not breathing and they're not getting any oxygen. So you kind of have to work your way down.
Okay.
Massive hemorrhage, more important, then airway, then respirations, circulation, and H is head trauma and hypothermia.
So what's the difference between breathing and respiration?
So at the beginning, you're talking about airway. So A stands for airway, and you want to make sure that they don't have any obstructions. Sometimes, especially in a combat situation, you get shot in the face, there can be a lot of swelling and blood and all that kind of stuff. So you want to make sure they have a patent airway.
Okay.
If they don't, you want to try to put them in a position where make it easier for them to breathe. A lot of times the casualty will want to put themselves in that position already. So if they are trying to sit up and lean over, the tripod position is pretty common where they put their hands on their knees. And what that does is it gets some of the weight off of their chest and allows for their full expansion of their chest back and forth. And that's a good thing. So if the environment allows, in a tactical environment, it might not be a good idea to sit up, you know, past your cover and take a round in the head. So you might not want to tell them to do it then, but if the situation allows, let them position themselves in a way that'll make it easier for them to breathe.
Okay, and I bring all of this up, and I'm asking Brian to explain this to me, because we often shoot, you know, quite a ways from a local hospital, and while it may be a peaceful, serene environment, these are real potential threats, you know, if we have any kind of malfunction. So I really appreciate the mini refresher course, if you will. We got some medical kits in, and they have QuickClot in them, and that's a common thing to find in them now. But in my prior teachings, we kind of leaned away from it for various reasons. It was good, it was bad, it was in your aid bag, it wasn't. So what is new about QuickClot, and how does one use it?
Okay, well, one of the biggest rumors that I tend to hear is something that's been sticking around for a while, and that's QuickClot will burn you if you use it. And yes, the old type of QuickClot could burn you. It had a thermogenic reaction. As soon as it hits something wet, it starts to get hot. And when it gets hot, then it can burn you. And one of the main problems that they would have, especially if they're out there working on somebody in the outdoors and it's windy, you can have a risk of it blowing into the medic's eyes, into the casualty's eyes. That's not good, especially if you got a helicopter coming in to land to pick up your casualty and you're sitting there trying to work on it. That's blowing things everywhere. And I talked to a medic, corpsman, who had a Bronze Star. I was asking him about how he got his Bronze Star, and he was in Iraq, and a Marine had gone off of the road a little bit and had accidentally walked into a minefield. Didn't realize it. Stepped on a mine, blew off his leg. So this corpsman goes running into the minefield, because he's a hero, drags this guy out, and as he's dragging him out, dumps a huge thing of QuickClot, the powdered granules, into the wound, and keeps dragging the guy. And the casualty is screaming the whole time. And of course the corpsman thought he was screaming because he didn't have a leg. Turns out he was screaming because the QuickClot was burning him. So it does save lives, but it's pretty uncomfortable. They don't do that anymore. So what they do now is an impregnated gauze, and it uses kaolin, which is a clay, a mineral that is found in a type of clay, and that's where they get their clotting factors from. And this is just a roll of gauze that has that in it, and you'll just pack that down into the wound, and that will help to control the bleeding and increase the body's ability to clot.
Okay,
that works
so
really well.
it's more used for gashing wounds, if you will, something that's bleeding a lot that you can get into, not your surface stuff that can be handled with, you know, your typical dressings. So what else is in this bag? What I'm seeing is an absolute essential.
Yes. I know you're
often
medic.
overlooked.
Yes, yes.
But these are absolutely essential in getting to your wound, because you can't properly assess inner or outer wounds without knowing, or not inner outer, but entrance and exit wounds. You've got to take those clothes off and get through there.
And I imagine shears like that with that rounded edge are probably a much safer way to open someone's clothing. Than
you don't want to further injure them by pulling out a knife trying to get their pants off. Trauma shears are the way to go. They're just very overlooked in first aid kits, if you will. So I appreciate that this is more of a trauma kit.
Well, I love, trauma shears are a big deal, because I've definitely seen lots of people try to go to a pocket knife, and that's bad, especially in a really bad situation where you got people running everywhere. If you're in an emergency, you never know what's going to happen, and you're sitting there working on your casualty, trying to cut their clothes off so you can get an eye on the wound, so you know what you're doing. That's why it's so important. You can't try to take care of something if you don't understand what the wound is. So you have to expose it. You got to know what's going on. But if you use a pocket knife, someone's running by as you're running this up their pant leg, they bump your elbow and you shove it into their femoral artery, you just made the whole situation worse. And sometimes you just don't have a choice. You know, as medics, sometimes you just got to make do with what you've got. But when it comes to cutting tools, I really recommend everybody have a set of trauma shears in their kit so that they don't have to worry about having to use a knife. The other beneficial thing is a lot of times people will go to like these expensive types of shears, like the Raptors. Those are super cool. I like them. I think they're cool. But the problem is I prefer the type of shears that I can just throw away afterwards.
Yeah.
Because it's going to be full of blood and meat and ugh, it's gross. I just pitch them. I don't try to wash them.
The first thing that you're going to be going to, so it will definitely be the nastiest.
Yeah. So in my opinion, cheap is better.
Yeah.
Because these work great. They'll cut through clothes, no problem. Seat belts, anything that you need it to do. But then after you're done, you don't have to worry about throwing them away and get yourself a new set.
Well, and oftentimes you're going to forget that you've even pulled these out by the time that your casualty has been moved on. That's the first thing you're going to use, and the first thing you're going to toss aside because you're finished with it. So yeah, having something more is not better unless the material you're fighting against requires that.
Yes, absolutely. I also think that, you know, if you do have to use a pocket knife, one of my favorite methods is to make a tent out of the material, poke a little hole with the knife, carefully put it back away and in your pocket, and then you just put your fingers in there and rip everything away. That works on jeans and shirts and pretty much any material I've ever come up against. So get yourself a little hole. As soon as there's a compromise in the fabric, it just tears away really easily. So that's the best way.
Especially if you've got adrenaline going.
Yeah. Hulk out.
All right, so beyond the shears.
All right, next on the list are gloves, and these of course are important to have. I usually like to have 2 pairs of gloves in there because I've been in a lot of circumstances where I'm in a hurry to get them on and I just rip through that first pair. So having a backup pair is always nice. It's also really nice because if you've got help nearby, which is great, if you're in an emergency situation, having a teammate nearby is nice. A lot of times bystanders will be in the area and you can direct them, hey, you get over here, direct pressure. This is what I want you to do. And then that frees you up to go take care of other people, get your medical kit, whatever you need to do. So 2 pairs of gloves is usually very beneficial. The next thing that we've got are just the little permanent marker for writing down the time of the tourniquet placement and taking notes, anything else that you need.
That's a good item to have that you don't see in many first aid trauma kits.
Yeah, I like to have it just because you never know when you need to write down an address. If you're talking to EMS or anything like that, you want to be able to have that material to write with.
But you mentioned time with marking the time for the tourniquet, and I think that's really important because anytime you're treating a casualty, you don't just treat someone. I'm not just going to treat Graham on the range and that's it. I'm going to have to tell the people that come eventually and assist us, or when I drop them off at the hospital, heaven forbid, I need to be able to tell them things, and I'm not going to remember that from point A to point B. So having something to write that down on or with is vital.
Yes, because if you're at a range, a lot of ranges are in rural areas away from medical treatment facilities, and so you might have multiple handoffs of that casualty, and all that information that you've been telling the EMTs when they arrive, they might not be able to pass that on, or it might get missed or something like that. So a little bit of documentation is always good.
Yeah.
Next is one of my favorite pieces of kit, and this is the SWAT-T. This is a tourniquet, and it is one of my favorite things because it adds huge amounts of redundancy to your kit. Not only is this a tourniquet, and I've done plenty of videos of this on my YouTube channel, so if you want to learn more about that, feel free to head over there. But this you can use as not only a good tourniquet, but also as a pressure dressing. You can use it to tie splints into place. You can use it as a sling. You tie a little knot in it, drape it around their neck, and you got a broken arm, they can drape it in that. You can cut off little sections of it and tape it down as a chest seal. I'm planning on doing a video soon on, I'm gonna try to make a slingshot out of it and go hunt up some game or something. I think that'd be cool.
That will be fun. I've never heard of this. I'm really curious to play with one.
Yes, and some of your viewers might know that that's not TCCC approved. The TCCC committee is the people in the military. It's a government think tank that comes up with all of the acceptable things to do in combat medicine. And they are the ones that say that the CAT tourniquet and the SOF-T wide are great tourniquets to use, but they don't recommend this one. It's not on the recommended list. That's okay, because I'm not in the military anymore. So my area of operation is different now. So this is not nearly as big a deal for us civilians. The main reason why it's not approved by the TCCC committee is because of the way that it secures.
Okay.
SWAT-T stands for Stretch, Wrap, and Tuck Tourniquet. So you secure it by wrapping it around the limb and then tucking it underneath of itself. And that's a perfectly acceptable way of securing it, but the problem is in the military, you're more likely to be dragging that casualty somewhere, pushing them over walls, carrying them places, and there's a good chance that that tourniquet could come undone.
That's a valid concern.
It's a valid concern, absolutely.
Operations.
But as civilians, we're less likely to be able to do that. And what's so nice about this is it packs so well. You can throw this into a front pocket.
Yeah.
It's soft rubber, so it's not going to be digging into you. If you're trying to carry around your cat tourniquet, this windlass getting caught and these clips makes it pretty uncomfortable to carry. So in my opinion, more lives will be saved if we can get more people to carry these because they're comfortable to carry, and you can it's like its own trauma kit.
Yeah, and it's bleeding, you need to tourniquet and things like that, but this might be a little bit too much for what we're truly dealing with in our only option, whereas this is going to give a little bit more flexibility
Yes.
in that, so less tissue loss over time. And
Right. Well, that's the other benefit of this is because it's so wide. I believe this is a 4-inch band, and the cat tourniquet is 1.5, 1.75. I'm not sure, but it's thinner. So what you'll tend to see is what's called tourniquet pain. You apply that tourniquet, it hurts. And
If
it
it's
should
done
hurt.
right.
If it's done right, it will hurt. So do not let your casualty talk you into loosening it up. I've worked on people without legs who complain more about the tourniquet. So don't let them talk you into, hey, can you just loosen it up just a little bit? It really, really hurts. If you loosen it up, they're gonna bleed to death. You need to tell them that, hey, if I loosen this, you're gonna bleed out. And the last thing that we've got here is another, this is a pressure dressing. This is the 4-inch ETD from North American Rescue. And this is just more bleeding control so that you don't have to make a pressure dressing with these items. It's already set up and ready to go. I think you said something earlier about, it's nice to have it out of the packaging already so you don't have extra steps. So this is one of those things you have to open up one package as opposed to having to open up 3.
Right.
So it's a little bit better to have something a little faster.
yeah, I always appreciated those, in that all of the components are in one place at the same time, so you're not looking for other things or in other pockets or opening, like you said, more stuff.
Right.
So those have always been a favorite.
The fewer steps and the more simple you can make things, the better your life's going to be, especially in an emergency.
And understanding your gear, what is in your kit, where is it at in your kit, in placing it in order of precedence and how you might need it at a critical moment. So
that's a great point. I mean, one of the things that I would always tell in my junior corpsmen, because this is something that the older corpsmen told me, is know what is in your medical kit and where everything is, especially if it's dark. Emergencies tend to happen when everything is terrible. Bad weather, it's dark, you don't know what you're doing, you don't have help. You want to make it as easy on yourself as possible.
we were taught to navigate your bag. And I really appreciate you coming out and showing us what's new on the market, refreshing my memory and how those things are used and things like that. Does your company offer larger kits and or smaller kits?
We do.
And you also mentioned that you can buy pieces individually?
Right, so this one is, anything that you see here you can buy on the mountainmanmedical.com website. So if you want to upgrade your kit or add new stuff to it, feel free to do that. This is the Yellowstone, it's our best seller. We also have the Wind River, which is a larger kit, and it's for taking care of more people and more issues. It also has a little first aid kit in it with like band-aids and some basic medicine and things, comfort items to help you out. Those are one of my favorite ones to recommend for people to put in their cars so that if they're out and about, they've got all that stuff nearby. Not essentially life-saving type stuff, but quality of life kind of things is nice to have. And we just came out with our mass casualty kit, which is kind of what we're designing for organizations to stock in their buildings. Active shooters or catastrophes or something like that happens, they can go and grab that, kind of like an AED would be used.
Okay, and what I would like to mention in being able to go to your website and buy products individually is when you open a kit and you use something out of it, your kit is no longer complete. You need to replenish, even if it's a Band-Aid. You know, you need to always take those things into consideration because you've used it. It's no longer there.
That is absolutely true. We offer refill kits as well, so if you just need a couple of items, you can go pick those up individually, or you need to replace all of the items in the kit but you don't need a new bag, you can do that as well. So we try to think about that stuff and make sure that everybody is getting as much quality gear as possible.
Awesome. Thanks for watching.